Hi, I'm Dr. Matt Russell from VSON Laser Vision Specialists. In this video, I'll answer the question that's on many people's minds: what are the LASIK eye surgery risks? LASIK eye surgery is, by any medical standard, an exceedingly safe procedure with the highest rate of patient satisfaction of a single procedure in the world. But like any surgery, there are some risks, and it's important that you know about these before going ahead with the surgery. A common issue that arises after LASIK eye surgery or any type of vision correction, laser surgery, is dry eye. Almost every patient experiences dry eye in the early phase after treatment, so it's not so much a complication, but an expected side effect of the treatment. Most people begin to notice a gradual improvement in their dry eye symptoms from 4 to 6 weeks after surgery, and the average time for dry eye to clear is 4 to 6 months. There's a small portion of patients who recover slower, and 5 to 10% have symptoms that last 6 months or more, and approximately 1 to 2% have symptoms that last more than a year. One LASIK eye surgery risk that is, in very rare cases, about 1 in 1,000, is that we may not be able to raise the flap during the procedure. And this usually happens due to what we call loss of suction at the time of LASIK flap creation. And in that case, we would have to stop the procedure and return 3 to 4 months later to create a new LASIK flap once the original partial LASIK flap has completely healed. An alternative is to return 1 to 2 weeks later, but instead of doing LASIK, we do PRK treatment, and that really depends on a number of factors which we'd need to discuss with you before making the decision. You won't have any disruption to your vision from having a partial laser flap. Within 24 hours to 48 hours, the vision will be back to the way it was before, and you may need to wear a contact lens in that eye if we've completed the treatment in one eye already. All we do is delay the procedure until it's safe to proceed. After LASIK surgery, there's a very small number of patients, about 1 in 400, where there are microscopic folds in the flap that need to be smoothed out. This is one of the main reasons that we see you the day following surgery. It's a relatively simple process to smooth the flap, and in fact, it's the last 30 seconds of the original LASIK procedure. It's virtually nothing to go through, and it would be something that we'd do following your post-op visit on day 1. Once that's done, the LASIK flap is typically stable and your vision will improve as expected following the LASIK procedure. It won't interfere with your capacity to get an excellent vision result, and putting the flap in position sets everything up for healing to continue to occur as we would expect. There are very small risks of irregular healing of the surface of the eye following LASIK. For most people who are in the range that would have laser eye surgery, this equates to between 1 per 1,000 and 1 in 5,000 chance of having a 2-line or more drop in the best possible vision. This would mean that if you started with vision with glasses that was 615 or slightly better than 20/20, a 2-line drop in vision would result in a reduction in vision down to the 20/25 line. This would give you overall very good vision, but it just would not be as sharp as it was in the best possible pair of glasses before laser surgery. In most cases, it's possible to regularize the surface of the cornea with additional laser treatment, but most people will actually improve spontaneously over several months. So we would delay any retreatment of that particular issue for 12 months to see if the cornea regularized itself and settled. With any procedure, one of the most concerning issues is infection. The risk of minor infection not affecting vision over the long term is approximately 1 in 5 to 6,000. If an infection like this developed, you'd make a full recovery of vision. The risk of a moderate infection causing a small drop in vision is approximately 1 in 20,000. And the risk of a serious infection causing a substantial reduction in vision, requiring additional treatment to remove a scar or even potentially a corneal graft, is approximately 1 in 30,000 to 1 in 50,000. The risk of a serious or severe infection is approximately the same as wearing daily contact lenses for 2 years, and is in fact incredibly small compared to wearing contact lenses for over 30 years. There are some very late complications that can occur in rare cases. There is approximately 1 in 5,000 patient who develops regular astigmatism months or sometimes years after LASIK surgery. This most commonly happens when LASIK surgery is performed on eyes that show signs of structural weakness in the cornea or in patients who have very large treatments, particularly at a young age. For this reason, we're extraordinarily careful to identify anyone who is at risk of this issue to avoid LASIK treatment in these particular cases. But usually there are some very good alternatives to LASIK treatment, such as transepithelial PRK or ICL insertion that allow people to go through vision correction in a safe way. Because of our expertise and because we know who is at risk of particular issues, and because of the exceptionally rigorous technology we use to screen your eye before you have the treatment, we know to avoid those risks and identify those patients who really should proceed with a particular type of laser treatment. And we're able to offer a full range of vision correction procedures so that we can really match you and your particular eye health up with the correct and most appropriate form of treatment. After 50 million procedures, LASIK surgery has been proven to be one of the safest procedures performed on the human body. The best way to know if you're a suitable candidate for LASIK or any form of vision correction we offer is to book a free laser vision assessment. You can book the appointment directly on our website, or you can call us if you prefer. You can even scan the QR code you see on the screen right now, which will link you directly to our online calendar where you can choose a time and date that suits you for a free initial assessment.